Hi, I'm Todd Kiesling. I'm a certified athletic trainer at Rejuv Medical, and I'm here today to talk about shoulder anatomy. The shoulder anatomy begins with the bony structures, and I've got a little model here to help us along the way. This would be a right shoulder, would sit like this. The bony structures include the shoulder blade, which is what I'm holding in my hand. Okay, that's also known as the scapula. The upper arm bone, right here, is the humerus, and then the collarbone, and that's known as the clavicle. The shoulder blade is a relatively flat bone with a ridge that runs along the back side here, and that's called the scapular spine. All right. At the end of that scapular spine is a curved piece called the acromion process, and that acromion process makes up a little tunnel inside above the ball and socket joint itself. All right. The ball is a little bit bigger than the socket. A lot of times we like to think of a basketball sitting on top of a golf tee. Okay, so to keep the ball aligned in such a shallow socket, we need a little tissue extension that makes that socket just a little bit deeper. And that little extension is called the glenoid labrum. The glenoid labrum is sort of like cartilage, but not really cartilage. And that can be a problem inside the joint occasionally when someone has a dislocation or an unstable shoulder. The muscles that surround the shoulder are known as the rotator cuff muscles. And sometimes you hear people talk about their rotator cup. It's not really a cup, it's more like a cuff, like on your shirt sleeve. And that's four muscles: supraspinatus, infraspinatus, and then there's the teres minor and the subscapularis. Those four muscles are what make up the rotator cuff. The rotator cuff is a group of very small muscles, and as you can see on this model, they're a little bit thicker than a lasagna noodle, maybe just a little bit wider or just as wide, and certainly not as long as a lasagna noodle. So they're very small muscles. Okay. At the end of each muscle, there's a tendon. The tendon connects bone to the muscle belly itself. And so in order to do that, we get a tendon at the end of each of these muscles. And that's where a lot of times we have breakdowns. And some of the other conditions that you'll see later on our website and on the videos will go into more detail about the rotator cuff tendons and some of the problems we have.